This podcast is part of the Everyday Heroes Podcast Network, the network for first responders and those who support them.
All right, another titillating episode of Scissors and Scrubs coming up. We're hot on the heels of Why Nurses Eat Their Young. And so now we're going to follow it up with the things you didn't learn in nursing school.
Yes, there's a lot of them.
Oh, are there ever? Are there ever? Laura went to a 2-year program.
Yes.
I did a 4-year program. I don't think there was much of a difference except the core college requirements. And I still can't believe I did a 4-year program because I'm the laziest person you've ever met in your life. I can't believe I didn't do a 2-year program, but I think at the time I had the time and I figured, what the fuck? Let's do 4 years. So I did. So, nursing school sucks. If you're doing it, it sucks. I hated every second of nursing school.
I did not mind.
I shouldn't say I hated every second because I loved the people I met in nursing school. Which, you're so close with them in nursing school. In the core group, I don't talk to any of them anymore.
I wasn't really that close to people in nursing school.
I was. We had a core group. Of course, I was the oldest one. Yeah. One kid actually was like, oh, I give you credit going back at your age. I was 26. I might as well have been 86 to them. But I had a great group of friends in there. And, you know, one's in California. One's working up in the North Shore. One's up in New Hampshire. I know some of you guys are listening. I love you all. I don't know why we're not talking, but we should have a reunion. I see some of them in the hospital sometimes that I went to nursing school with. And you just bond with them in a different way than I think. I mean, I did. I bonded with them because you're going through the same shit. You know, you get out of clinical. You're like, oh my God, guess what happened to me? Blah, 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 you know.
I'm going to say this, and I'm probably going to be
here
very
it comes.
hated.
Here it comes.
I did not find it hard.
I didn't find nursing school hard because I had already been in the OR.
I didn't find it, like, stressful. Like, people are so fucking stressed. I'm like, I don't know what I didn't do, but I didn't do any of it. Like,
I got married during nursing school. I got pregnant during nursing school.
I'm like, I don't know. I think you're stressing yourself out. Like, take it easy. Take a deep breath. Pay attention in class, and you're going to pass.
But I also think I had done 10 years as a surgical tech before I went to nursing school. Yeah. So I was already in that environment. I think that helped me, like, ridiculous. You already knew how to talk to patients. You already knew how to talk to doctors. You already had a presence about you that an 18-year-old coming out of fucking high school does not have. Yeah. And isn't going to have for a long time.
I also went to school with older people because, like, it was like LP, like it was a lot of LPNs to ASN, and so I think they were more stressed.
I think older women get stressed no matter what.
Right. Well, I mean, it's just, right? You have,
like the mothers come in and you're like, even in tech school, I went to school with a couple of mothers. I was like, ladies, throttle back, dude.
But I mean, I'm sure if I went to school now, I would be stressed about it. But I'm like, oh, I don't know. I mean, they were extremely stressed. But it was, you know, like, so I was always like, I don't understand what everybody's so stressed about. But I was also, 19. So when I just, I don't know, it just.
You're seeing life in a different way. I mean, they're stressed. They get families. They got
this. They had other shit going on, and they had to pass this, to continue their careers that they already had.
And to make money for their kids or whatever. So, I mean, 2 things you'll never see me do in life. Run a marathon and go back to school. I will never go back to school. Nothing about writing papers and all that bullshit. I don't need a master's degree. God bless all you that get your master's and your doctorate. Not for me. Yeah. Not my thing. No,
I'm happy where I am.
First thing that nursing school does not prepare you for. We're going to read a couple from some things we found on the internet and elaborate. And then we put a post up and we got like over 300 replies of
oh my God.
OR stuff. Yeah. So we'll go over the things because OR nursing, we've talked about this before. It's a type of nursing that is like not known. A lot of nursing school is just, you do a day in the OR, you kind of breeze through, nobody talks to you, they just tell you don't touch anything blue, and then you're on your way and you never see the OR again, and you just yell at them all the time because they're always like looking for a bed, or they want to can you take this patient? So the OR is like a secret society almost, and it's a type of nursing that really is not like nursing. Nothing in nursing school teaches you for the OR.
What to do in the OR.
Nothing. So I knew what to expect in the OR because I had worked in the OR for 10 years already. And I was tired of seeing the nurses scrub in and do my job for triple the amount of money. So I said, hey, dumbass, get off your butt and go back to nursing school.
It only took me 1 year
It took me 10. Well, I was traveling and I was having a lot of fucking fun. And then I finally was like, I guess I should make more money. So We're going to talk about regular nursing school, and then we'll cover the OR.
Yeah.
All right. So number 1, school didn't prepare you for how nursing changes you.
It doesn't talk about that.
Let's just say I was very sweet and quiet
before
I went into
at all. I do
my
not
mother
believe
would
that.
be like, I can't believe that you said that. I'm like, oh, I wouldn't say shit to a doctor at 19.
No.
At 49.
No, you can't
Fuck
stop me.
you.
Who do you think you are?
At school, you won't learn how nursing can change you, how you become someone more aware of his or her environment, more sensitive to pain and care. I'm more sensitive to pain. Nursing becomes a part of your overall personality and moves from just being a job to your calling. All right. Let's just clarify right here. All right, it's not my calling. Never in my life, if somebody asked me, did I want to be a nurse, was that I wanted to be a U.S. Marshal, helicopter pilot, forensic pathologist. I never wanted to be a nurse.
Yeah.
I fell into nursing. That being said, I love what I do.
Yes.
I love being a nurse.
Mm-hmm.
But it's a hat that as soon as my locker closes, goes in my locker, and I put on my friend, fun, mom, everything else hat, and I go home.
Yes, but you also, when you're in a situation where it comes right out.
You're right. You're right. And
not
when the neighbors
really
come
true.
over, like, can you look at this rash?
Yeah.
You really need to see a doctor. You're always giving advice to somebody. Agreed, but
So it is part of who you are.
Yeah, I guess you're right.
Because even if you're at a concert and someone falls and is on the ground, you're
you're
person
gonna be the
over
one.
there.
Yeah. Because
It's part of
everybody
who you
else
are.
is just going to stare and take video of that person convulsing on the floor. Okay, what do you got?
You will work every holiday for the first 3 years of your career. Well, I don't know where
First
you
3?
work, but you will work every holiday forever.
For the rest of your life.
Right, you are working nights, weekends, holidays. You do not have the same schedule as all of your friends.
No.
They can all go out on Friday. Well, no, I can't.
I'm working.
Do that. I work.
Yeah.
Your family doesn't understand. Well, why can't we do Christmas dinner? Because I have to work Christmas. Like
People still get sick on Christmas. People
Right.
still get,
my place does not close. I have to work whenever they
How
tell
come you
me
can't
to
go
work.
to the beach for the 4th of July?
Right.
Because half the society is going to blow their fucking
Right.
hands
I
off,
have
and somebody
to
has to be there to put them on.
Right. So it's your schedule is never going to. You will. I mean, I guess if you work at like a surgery center or like you'll just work Monday through Friday, 7 to 3.
If you were working in a big hospital,
that's it. If you're in a big hospital or any hospital, small hospital, any hospital, you are open 24/7. So you will be
you're
working.
on call or you're working.
Yep. Your schedule,
our
you will
hospital
never ever have a normal schedule.
Yeah, our hospital is staffed, highly staffed.
Yes.
24/7.
Yeah.
But I mean, small hospitals you can call, so they take a shit ton of call.
Right.
When you're on call, you can't drink.
No.
You can't really go too far from the hospital. You
Right.
have to be 30 minutes from the hospital.
Right.
You can't do this. You can't do that.
Mhm.
You can't get caught up in anything that you can't leave in case
Right.
you get called.
Right.
Or you're in there all fucking weekend because you're on call.
Right.
Okay.
Your schedule is never again.
The same.
The same.
No, it's brutal.
They do not prepare you for that.
No, they don't. I remember thinking when I was going to be an OR for a scrub tech. I was like, nobody does OR on the weekends. Like, nobody operates on the, like, I thought I was going to have this great fucking schedule. I was highly delusional.
Yeah, dead
I
wrong.
don't know what I was thinking.
Yeah.
I was like, oh my God.
Dead wrong.
I worked every weekend.
Mhm.
Okay. School didn't teach you how to give a good report. School didn't teach you the basics of how to give a good report. But it's only when you hit the floor and learn how to coordinate your brain and communication skills to deliver the right message that you understand giving or taking a report effectively requires you to be alert, on the point, in possession of all salient facts and confidence. Only experience teaches you this. We give a different kind of report in the OR, but you do have the nurses who are like, okay, so this patient was born in 1925.
Well, I think that's what that says. I think the most important thing that little blurb just said was be on the point.
Yeah, be concise.
When on the floor in the ICU, whatever. If you're rambling on about their past
Bullshit.
history that
Yeah.
happened 25 years
They
ago,
like chocolates and
they
they were
had
born
their
under the zodiac.
meniscus fixed 25 years. It doesn't
I
matter.
don't care.
Literally has nothing to do. And then you've lost the person. You know,
Yeah.
like you have to be right on the point. This is why they're here. This is their pertinent history. This is
For
what's
me,
going on now.
I want to know what we're doing.
Yeah.
I want to know what your allergies are.
Right.
And where are we going afterwards?
Right.
That's about all I need to know.
Yeah.
There's a few other, but those are my basics.
Mhm.
I don't care the eye color. I don't care where he was born. I don't care what war he was in. I don't care.
Right.
Tell me where the family is so I can contact them afterwards. Let's call it a day.
What do I need to know to do
right now
this?
to get through this
Yes.
guy? Yeah.
Yeah.
I'm literally like, okay, yeah, okay. I literally said to one nurse one time, I don't need to know that. I don't know why you're telling me that. That's not important. What are his allergies?
Right.
You know?
because it gets lost, and then the important things get lost. Yeah. This one says, how to complete a bed bath on a ventilated patient with an arterial line, 2 central lines, a tracheostomy, all while currently on a sedation vacation. The point of this is they tell you in nursing school, you're going to give a bed bath and your patient is completely fine, can help you move all their limbs, pick up this thing. You get into the real world, it's a nightmare. They have not prepared you. No, like
they've got a gaping sacral wound.
Right. How am I supposed to do this by myself with you're taught very specific
instructions.
Very run of the mill instructions. You have to learn. They do not teach you how to work on the fly. Mm-mm. That comes on your own, and some people never learn it. Some people pick it up right away. Some people it takes a while. Some people just, it's not going to happen. But you have to learn how to just go on the fly. Think outside the box.
On my younger days, we had this older nurse that would come in and do per diem. Mm-hmm. She had her doctorate, and she was a nursing instructor. Mm-hmm. In nursing school, you are taught never to clamp the chest tube. Yeah. Never to put it above or anything like that. Okay. In the OR, it doesn't always work that way because there's no place to hang the chest tube. So we have a patient with the chest tube, which we deal with all the time. I'm doing what we routinely do. And she's like, oh, no. You're not supposed to put it there. Okay, where would you like to put it? And she's holding it by the, if you've ever seen a Pleurovac, it's got little hooks on it. So she's got it by the little hooks and she's walking around.
Under the level of the chest.
So she puts it under the level of the chest. I said, and what do you think's going to happen the moment the bed moves? And she's looking at me. I said, go ahead, move it. And the chest tube starts to tip. I said, you can't have a tip. Mm-hmm. So she puts it exactly where I was going to put it. Yeah. And then when we first started scrubbing, we had the cloth drapes. Mm-hmm. So you had to clamp the chest tube to take it, unplug it. One of the nurses reads me the Riot Act. How would you, do you want me to cut every fucking cloth drape we have to get the chest? The surgeons watch you do it, and they don't say shit. Yeah. What would you like me to do?
You have to do some things
differently
that go against what you're taught sometimes.
But you have to know that. Right. And you have to know that the 2 seconds I'm going to clamp this is not going to send this person into a pneumothorax.
Clamp it without
asking
the surgeon knowing. Right. Or the surgeon saying, please clamp that to undo it.
Right.
And
then know the procedure. Back. And for the 2 minutes that this chest tube is going to go up to the floor is not going to kill this patient. Yeah. But she was so ingrained with nursing school, and it was just cracking me up watching her walk around with the Pleurovac trying to figure out where the fuck she was going to put it on the bed.
Yeah. When I worked at our hospital as a surgical tech, and then I went to a small hospital right out of nursing school because they paid my loans back. I knew I was going back to the big hospital, but I worked there to pay my loans back.
Because you knew you were going to come work with me.
Yeah. So we did something, and we put a chest tube in this patient. They don't do a lot of chest tubes at this small hospital. So I take it, and I'm moving it, to put on they move the patient over, and I take it, and I go to put it on, over. I had to bring it over the patient because it was on the wrong side, get it on the right side. And you have to pick it up and put it over the patient because it cannot go. It's not long enough to go around.
You'll rip it out.
Right, I'm going to rip out the chest tube. Oh my God, you would have thought I murdered the patient. Oh my God, stop. The chest tube can't go above the patient. I'm like, okay, well, you have to get it on that side though because this is bad. It's going across the body. You have to get it to the other side of the bed. What do you want me to do? You can't put it above I'm like, oh my God.
Then you do it. And you show me how you're going to do this.
All the time at the hospital I work at now and formerly worked at. I'm like, we literally do it, I don't know, 30 times a day. Yeah. It's fine. Yes. We're not doing, it's not staying there. It's not going to be above the guy's head. We have to move it. You would have thought I was murdering the patient the way they were responding.
I was toe to toe screaming with one of the nurses who was, I'm going to write you up. I said, make sure you fucking spell my name right. You want me to call Dr. So-and-so right now and bring him down here and you can tell him why the drapes are still on the patient. We were screaming. I'll call him. Because I was good friends with this doctor. I'll bring him right down. And she just, I never got written up. Let's just say that. Because we do it 30 times a day.
You have, right. And is it the correct way, quote unquote, that you're taught? No, but sometimes things have to be done sometimes.
A certain way.
They don't prepare you to step outside the box.
I was just going to say, I think with nursing, you have to think outside the box.
Yes. And you are not prepared. You are prepared.
But that's
you have to do it this way
right. That's your critical thinking skills. You have to know that I'm not hurting the patient doing this. Because there are things you should never fucking do.
Absolutely.
You don't want to extubate the patient without anesthesia knowing. Accidentally. So there are things you need to do, but you need to know, okay, this is what we do. Think outside the box with your critical thinking skills. Was it you or was it mine? Which one did we just do?
Mine.
Was that me on how to give a good report, or was that you?
No.
Oh, the bed.
Complete bed.
School doesn't teach you that you have to keep up or be left behind. I don't really know I didn't read these ahead of time, so we're all learning these together. Nurses are a busy lot and cannot make time to mollycoddle a new recruit. Ooh. Oh, is this nurse bullying?
Oh, that sounds like it.
You'll have to hit the floor running and get on with the job. Your senior nurses will only expect you to do the job and work as a team with you. Who the fuck do they work? You'll learn patient care, charting, and the nuances of teamwork. If you don't keep up with the pace, you'll be left behind. Okay. I don't know if that's what they're trying to say, but here's what I'm going to take away from this. I think nursing is a lot of on-the-job training.
Yes. I think it's mostly on-the-job training.
Yes. I would say 90% of it. I think you get anatomy and physiology in school. Mm-hmm. You get what things are and some of what you're going to see. But IV pumps are different in every hospital.
Yes.
Vents are different in every hospital. Machinery is different in every hospital. Beds are different in every hospital. You have to learn all that on the job.
Right.
How to talk to patients, how to talk to surgeons, how to stand up for yourself. All of that's on the job training. So I'm going to go with that's what they're trying to say. But you can't linger and dwell over these things. You have to be able to pick it up and go and pick up new information every day and work with it. And you can't, you're going to be left behind if it's taking you weeks to figure something out.
Well, even just say the chest tube thing we were just talking about. So you were taught you can't bring it about the patient's chest. We're saying we have to get them onto this bed. Momentarily. We have to do that. If you're going to sit there and just say we can't, then you have to get them out of the goddamn room though. So you have to move on. Like you have to say, okay, we have to learn, adapt, and move on.
Right. And you have to learn how to do things. You have to pick up that IV pump. And it can't take you 10 weeks to learn how to work an IV pump because you're going to be working an IV pump every fucking day.
Right.
And people are going to get really aggravated if you're 3 weeks in.
Right.
And you're still asking, how do I run this?
Yeah. You have to focus, learn it, and do it.
Right. Right. So your learning skills have to be, you're going to hear a little bumping because I'm moving around a lot. So you do have to be a quick learn. Yeah. I think. You have to be able to pick stuff up quickly.
Yeah.
If you can't pick it up quickly, I'm not saying nursing's not for you, but there are certain nursing jobs that may not be for you. ICU may not be for you because ICU nurses...
Yeah, forget it.
Yeah, they know everything. They're running dialysis machines and vents. And I mean, they're unfucking believable, the ICU nurses.
Yeah, you can't be
No.
You have to be a quick learner.
You have to have a skin-like fucking armor of a knight down to work in the ER. Okay, what you got?
When a patient is dying, you will likely spend more time comforting and cleaning vomit of the family members than that of the patient. This is true. They don't tell you
how to deal with families.
How to deal with families. In any situation, they don't tell you that. But especially in a dying... Yes, you're taking care of your patient who's dying or deceased, but you're now the caretaker of that family. They don't tell you how to talk to people. They don't tell you what to say. You always feel fucking awkward.
Yes.
You're going to always feel fucking awkward, no matter how many times you do it. It's an awkward thing because it's very personal and everybody
You're witnessing one of the worst moments in somebody. Like, the only time I deal with patients dying in nursing is when we do a DCD, which is a donation after cardiac death. And they bring the patient down, they bring the family down, they extubate the patient before the family gets there, and the patient expires with the family beside them. And then they will donate organs when they're done. They have a nurse specifically for the family because the circulator can't be doing both roles. Yeah. And it is awkward and you don't know what to say. I'm not good with I'm good when somebody's dying for the person who's dying.
Right.
I don't know what to say to you when you've lost somebody. I don't know what to do. I don't know I don't want to overstep my boundaries. Right. So it's a very awkward position, especially if you're awkward about it.
Yeah.
So we always have the chairs and we have the water and we have the tissues and sometimes we're crying right beside them because it's just as sad. But and they're going to remember you. Yeah. It may have been 5 minutes you spent with them, but they're going to remember you because that was the worst time of their life.
Right. They won't forget anything that happened at that point. It's just an awkward...
You can't teach this.
You can't. And you can't... I'll tell people, okay, make sure you have chairs, not on wheels. In case they pass out, make sure you have tissues, make sure you have water. I always keep a smelling salt. You go up, you introduce yourself. I'm very sorry. Blah, 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 blah. And then you kind of have to see how they react.
Right.
Because some of them don't want to talk to you at all. And that's fine. You don't have to talk to me. I'm not here for you. I'm here for whatever you need me to be. You don't have to talk to me. Some of them tell you their whole life story. Mm-hmm. And, oh, that's interesting. And, like they want to talk about something else. They don't want to talk about
that person
or that this is happening right now. One guy was telling me all about where he lived and what he did for a living. Not the dying person, like him himself.
Because he doesn't know what to do either.
But he just wanted to talk. And I'm like, that's fine. Whatever is making you, but you can't teach somebody. You just have to learn that.
It's experience.
You're either going to do it or not.
You're either good at it or not.
Right.
That's it. I had one family. I'll never forget this. The patient, it was on the news. And young kid, it was awful. It was a tragic experience. Person had methylene blue, so they were bizarre looking to begin with. The family came down, and I didn't know what to do because they were hysterical laughing as the patient was dying. I'm assuming that was their way of dealing with death. I mean, crying. They were laughing so hard. Singing songs, joking, laughing. And I was like, I don't know what to do here because I've never seen anything like this in my life. Left the OR still laughing. I was like, I guess good for them.
Yeah.
That they could laugh their way through it.
Right.
It was the most bizarre experience in my life.
Because then you don't know what to do.
I didn't know what to do.
I don't want to laugh because I don't want you to think I'm laughing.
I don't think anything you're saying is funny, first of all. Maybe it's all inside jokes.
Right.
None of this is making me laugh.
Yeah.
My heart breaks for this kid.
Right.
But more power to you people.
Right.
I just was like, do you need water? What do you want me to do?
Right.
I hate when I have to do that role.
And,
I hate it.
Like, you don't know. Like, I'm not a toucher.
Touchy-feely, yeah.
I don't want people touching me. I don't. But you feel like you should not touch these people, but like put a hand on their
human
shoulder.
Contact is a big thing.
And I don't mind doing that, but you just don't know how they will react.
Right.
Right? Because some people, I don't want to be touched.
Right.
I don't want you to touch. You're making me worse by touching me. But some people need you to touch. And it's just, you have to just read it. Yeah. And it's just
It's some people come alone.
Yeah.
Which is even worse. Like a mother and a young kid. Oh, it's just not a good time.
No.
Fortunately in the OR, I mean, we had one case. You and I were together. We talked about this kid all the time. And it was a horrible, horrible accident. The patient was literally unrecognizable. Yes. And after what we did to them, it was even worse. Yeah. And, we couldn't stop oozing. I mean, I'm not going to get into the graphics of what happens to a body, but a lot of things come out.
Yeah.
And the family member wanted to see them. Mm-hmm. And we were talking to the resident, and we're like, you really want to tell them they don't want to see their family member. Like, this was a woman's son. You don't want to see them like this. Well, she really wants to see him. I'm like, there are 3 mothers in this room telling her she does not. There was nothing we could do to fix this kid in a way that she could see him.
Yeah.
And thank God there was another nurse on who is when it comes to, if I have somebody dying in the hospital, this is a nurse I want with me because she's the best woman in the whole goddamn world. And she went down and talked to the family member. And like you could literally hear the woman wailing on the phone when I was talking to the resident. And she talked to them and convinced them it was best because no mother would want to see their child like this.
I am all for, you want to come see them, I'll make them as pretty as I can make them feel.
We do our best.
But that case, I will never forget that kid's face. That mother would see that kid's, and it's not your child.
Having done trauma for as long as we've done trauma, I have a Rolodex in my head of different people who have come through who didn't make it that I will carry with me. And he is number one. To the day I die, I will never forget this person.
And you don't want to see your son's face.
Exactly.
Like that.
I'm not related to this person and I'll never forget him.
Right.
Forget it if it was my child. I would never want to see my kid like that.
No. And even though that's happening, and you don't want to say to people, don't see them, but at the same
see them after the mortician's gotten a hold of them and can fix things up and make them look presentable and do what they do to make them look presentable. Right. You don't want to see them fresh out of the trauma they went through.
No. I mean, some of them are fine. This one was not.
No. All right. So
but they do not prepare you for any of that shit.
No. And there's no way to prepare you for it. Even some of the new people coming through, they don't know how to deal with it. And I'm like, okay, well, on this shift, you're going to have to learn how to deal with it because we do it a lot. Yeah. It happens.
Yeah, it happens.
Okay. What you got?
A quote-unquote allergy, according to patients, is actually anything at all that they don't want to take. It sometimes has nothing to do with the anaphylaxis. You will go through the whole goddamn thing, and they'll have 85 allergies, and it's lisinopril. Lisinopril, one of the side effects of lisinopril is makes you cough. That is not an allergy. It is it's a side. You can still take the pill. Literally, I don't even have to look every single time.
It's coughing.
Lisinopril, coughing. I'm like, okay. They don't like it. They don't want to cough. It aggravates them.
Narcotics make you nauseous.
Yeah,
every single one. Oh, it makes me nauseous. That's what fucking narcotics do.
Right. It's fine, whatever, but at the same time, like, then sometimes when you're scanning through that, it makes you take an actual allergy.
Not serious.
Less serious. Yeah. So you have to pay attention.
Mm-hmm. Yeah. Pay attention to the
Yeah.
We had one patient, he had like 9 allergies. Almost all of them were to anesthetic drugs. And anesthesia and the surgeons almost always would tell, oh, it's not a true allergy. Oh, latex, it's not a true allergy. Okay, well, I'm going to treat it like it's a true allergy anyway. Oh, well, the patient had a true allergy to one of these anesthetic drugs that they gave him because it was not a good scene.
Yeah.
All right. School didn't teach you multitask and prioritize. Learning to multitask is part of the job description if you are a nurse. No shit. Mm-hmm. You cannot say that you have been assigned a task and you'll take up something else only when a task is done. You have to comply with different requests from staff and patients and manage to juggle them all efficiently. More important than multitasking is prioritizing, hence critical thinking skills. When you have multiple patients in your care awaiting medications, checkups, follow-ups, and so on, you have to learn to prioritize patient needs. So, I'm scrubbed.
Yeah.
All right. This is years ago. And the transplant surgeons at the time were brutal.
I remember
one of their children works with us now. And I'm scrubbed in little tiny room 1. You weren't even there when this guy was a transplant surgeon, but his son works with us now.
Oh, yes. Yes.
So we're in little tiny room 1. And the nurse I have had been a nurse for 125 years, I think. In 1811, she had her job interview. So I, knew liver transplants was still new. So we're doing in room 1. We're doing a liver transplant. And I was like, I need, a 3-0 Vical. She's like, uh-huh. And they're like, 3-0 Vical, 3-0 Vical. I'm like, I need that 3-0 Vical. Yeah, I'm getting it. Yeah. She's over there playing on the computer. She's picking her nose. I was like, I need that. The room's 2 feet wide. I mean, she could have reached out. She gets up. She's picking lint off the floor. She's over there fixing her shoes. I'm like, could you move a little? They nailed me to the cross. Okay. And that's where I was like, could you just prioritize? I need this now. Right. Everything else could have waited.
You can do the chatting when you sit back down.
Exactly. Yeah. I wanted to kill her.
Yeah.
And I found that all the time. Mm-hmm. When I was a new scrub, they thought I didn't know what I was doing, so they just did other shit. On one surgeon, I love this guy too. He's retired now. We were doing a knee. I needed the tray of the inserts for the knee, I asked for the tray. You don't need those. I'm going to need those. Mm. You don't need those. Out of the room she goes. He asks me for the tray, and I'm like,
it's right there.
I said, she won't open it for me. Maybe you could say something. He came in, he's like, for the love of Christ, I asked you for it. Could you open those for her? She asked you. I heard her. He was going all over her. I was like, told you. Mm-hmm. I do know what I'm talking about. Mm-hmm. I've done about 80 of these now.
So. I do think, though, nursing school does... I think they teach you the importance of prioritizing. But that's something an individual... You either know how to prioritize or you don't.
You have critical thinking skills or you don't.
Right.
They're hard to teach.
But I think they definitely go over... Because all your questions on the NCLEX are prioritized.
Delegation. Yeah.
Delegation. So
that's the thing. They teach you how to take the NCLEX, which is delegation, safety, but they don't really teach you nursing.
Right. But they do... I disagree with they don't teach you that. I think that's just up to an individual to actually know how to do it.
Right. Yeah. Right. To figure out what's important and what isn't. Right. And you're not going to know that till you're doing it.
Right.
Okay. Go for it.
The doctor is always right.
Bullshit.
Yeah. They teach you... I think they teach you that.
Yeah. Don't question the doctor.
I think that's pretty, you're told, they give you the orders, you perform the orders. Well, if the order doesn't seem right to you, you are the patient's
You're the first
protector.
Line of defense between you and them.
It might be right, and maybe you're misunderstanding, or you're wrong. You could be wrong, but it's not going to hurt.
Good question.
To say, hey, is this, oh, did you mean for this? Or do you think this is right? Like, you can bring it up in a nice way. Mm-hmm. But you should always, you're the first line of defense.
Because you got to realize, too, and especially in a teaching hospital, they may have been a doctor for a month. Mm-hmm. They're actually, whether they know it or not, are relying on you to make sure they're doing it right.
Right.
And they're new, or they're tired.
Or what they make 80,000 patients under their care and mix up.
Yeah, they make mistakes like anybody else. Right, they are not infallible. No. And so you need to question. I mean, you need to make sure you're right. I may ask them 4 times to make sure they're absolutely right on something very important. Yeah. I don't care if I look stupid.
I have driven them
crazy. One more time. I just clarifying
just
here.
Just look at this again. Yeah. This is what you want,
right.
Yes?
We are correct here, right? Because I actually just did this the other night with a doctor. The patient came down. One leg had huge edema on it. The other did not. He wanted to put boots on. You want boots on this patient? Yeah. Are you sure you want boots on this patient? Mm-hmm. Yeah. Have you looked at the patient's legs? Mm-hmm. He turned around, looked at the legs. Yeah.
Both legs? You want both?
I'm not really comfortable with this. And then he looked like, no, don't put them on both legs. That's not right. I'm like, yeah, I know. And then another one, the anesthesia told one of the newer people to put the NG tube to the door knock. No. And I watched him hook it up, and I went right back over, unplugged. I said, I'm not comfortable with this. And the anesthesia looked at me and said, this will suck the stomach out. Yeah. You cannot hook this to the door.
Way too powerful.
Because it was, the fluid coming out was so strong that they could, I'm like, if somebody walks by and cranks the doorknob, you're going to kill this patient. Yeah. I'm not comfortable with this. Oh, yeah, you're right. They're not paying attention sometimes. Right. So you are the patient advocate. Mm-hmm. Period. I don't care what kind of nurse you are, what floor you work on, what department you're in. You are the nurse, you are the patient advocate. Yeah. Period. Especially in the OR, because the patient cannot advocate for themselves.
Right. They can't say, hey, I can't have that. Or,
right.
No, this leg is, look how swollen my leg. They can't say it. Right. They cannot speak up for themselves.
I say to the students all the time, you have 5 minutes with that patient awake. Sometimes it's the most important. You're taking them off a cliff because they're crying when they meet you. And you are more important than anybody because you're making sure nobody's going to hurt that patient when they're asleep.
That's your job.
Yep. You're making sure they don't cut off the wrong leg. Yep. You're making sure they don't suck the stomach out through the door knock or do something stupid. You're making sure they do not hurt that person because they cannot talk for themselves. Mm-hmm. It's the most important thing you can do. Mm-hmm. Okay.
Anyways.
Is it me?
I think you did. Oh, yeah. We just did the dark side.
School did not teach how to manage your stress. No shit.
No, it didn't.
Even in nursing school, the enormous pressure to learn causes stress among students, yes. Yet healthy methods of coping stress are not taught in school. You'll have to learn how to cope with your stresses on the job and pick up pointers via research and your colleagues. Either you learn to cope with your stresses or fall into the standard stress responses. Overeating, undereating, worrying, missing sleep, and burning out, which we've talked in our last episode.
Yes. Listen to the last episode.
Listen to the last episode. Yeah, we're not gonna rehash. We're not rehashing, but yes, it's an extremely stressful job, and there's gonna be scenarios that come up at your job that you're gonna be chewing over and kicking you. I can't believe I didn't say something. I should have said something.
Think about things for. I was just talking to another nurse about this. She's like, something happened. She's like, I'm like, blah, blah. I'm like, I know, but you can't. That's fine. Like, it's nothing bad. Like, she's like, I know, but I can't. I'm like, I know, because I did the same thing the other day.
Said
and I was
this.
like,
I should have did
Jesus, and it's eating at me, and like, it's not even. Nothing's gonna come of it. Right. It's just there's just
it's human nature.
Stress.
It's human nature. You're gonna get stressed. You should have done that. I could have did this better. I should have said that to them. You have to learn how to leave a job at home. Yeah. We've talked about this at work. I'm sorry.
Don't take a job home.
We've talked about this in the last episode. You have to take off your scrubs, take off your shoes, leave them there with all the fungus and disease that's on your clothes.
Please leave your shit at work.
Go home and go do something else. Go for a run, go to the spa, get your nails done. I get my nails done all the time. I get my facials.
Sit there and watch Netflix. Just whatever.
Seinfeld's back up. It's great. Yeah. Go with it. Yeah. Okay.
Nursing school doesn't teach you about the smells.
Oh.
No, it does not.
I just walked somewhere today and Vienna's like, it smells like poop. I'm like, oh, this doesn't smell like poop at all.
No,
you have no idea.
Until the poop is running off the sides of the table.
Until you can taste it. Yeah. This doesn't smell like poop.
No. Until you go home that night and it's still like, I have it in my mouth. I swear to God, I have it in my mouth.
I think my hair smells like shit. Yeah. I've said that to Brian. Do I smell like fecal matter?
Do I still? He's like, no. I'm like, really, I smell it somewhere still.
Poop. Necrotizing pus.
Oh.
Necrotizing skin. Vomit. I mean, I talked about it before. The patient gunshot wound to the chest and his stomach exploded. And as soon as they opened it, it smelled like 15 people had vomited in the room. Yeah. I can handle poop. I can handle pus. I can handle almost any smell, but vomit. It was.
Because the smell of vomit makes you vomit. It
was like a vomitorama. And I'm trying to, and the sponges are covered in food, and I'm trying to bag them up. And another nurse, God bless her heart, came in and she's like, "You're not doing too well. No, this isn't good." She's like, "Go take a break. I'll get the smell out of here." When I came back, she bagged up the smell. Thank God, because it was not pretty.
Yeah, no, some of those smells, God,
horrific. Yeah, and my go-to is benzoin. I put benzoin on my mask because I love the smell of benzoin. So I cover my mask in benzoin. Other people have the peppermints and...
I like the spray that we put for the kids on the oxygen mask. You know how they do like the bubble gum? Yeah. I like the bubble gum spray.
Yeah, you try all kinds of stuff. When some people come in with like Fournier's gangrene, which is like the rotting of the balls. Yeah. Listen to I think it's one of our Father's Day episodes. The infections can be nauseating.
And you know what it is when you're walking down the hall. You're like, someone's got a Fournier's down here. Yeah. I mean, you know the smell. There's certain smells that you know exactly what it is. You don't even have to be in the room.
Code Brown. You know that a moment you walk in the door, you're like, oh, there's a Code Brown.
Yeah. That's like that time with the poop running off the table. The scrub was like, I think they pooped. I'm like, I don't smell anything. But the nurse's desk was kind of further away. She's like, there's poop. I'm like, all right, I don't smell it. And I'm like looking, Bubba, she's like, And she just kept, nope, it's something bad's happening under here. I'm like, I literally can't smell it. Then all of a sudden,
the waft.
And I was like, oh no, there's poop somewhere. Yep. And then we looked under the bed and it was just running rivers of poop down onto the floor.
And the thing is, OR poop
it's different.
It's not hard.
It's not
It's not like you can scoop it up like kitty litter. No. It's usually liquid. Sheer liquid.
Thick liquid, though. Not like a liquid you can just mop up.
It's in every crevice.
Oh, it's everywhere.
It's in every pubic hair. It's on the legs. It's in the boots. It's on the tubing to the boots. It's on the Foley. And you have to clean it up. Mm-hmm. Never a good time.
No.
And thank God we're in a teaching hospital, because the first thing I do is get the med student at the intern.
Hold the legs.
Come on over, pal. Put on a gown and gloves. You're holding the legs. And then there's towels and sponges. It's
drapes and
the smells. I'm gagging thinking of the smells we come across.
Yeah, it's bad.
The smells are rough.
You are never prepared for the smell.
Feel free to share on any of our social media the smell that gets you the worst.
And we work in the OR, so we're used to the Bovie smell. Yes. But if you don't work in the OR... It
smells like barbecue chicken.
I know. I'm hungry with the Bovie smell.
You smell that, I'm like, woo!
And I'm like, oh, ready for lunch. But, which is disgusting, I know. But when you are not from the OR... That smell will make you pass right out.
Every time. Yeah. Every time. And the teeth. When people have rotted... the throat pack. When the throat pack comes out.
No.
I just said to somebody the other day, she had never done OMF. I'm like, oh, honey, wait till the throat pack comes out.
Right out into your face.
And it's in the bucket. And you're going to... It's always on somebody who hasn't brushed their teeth ever.
Yeah.
And they've got a pussy and it's fucking gross. That throat pack.
Anybody though. I think when you extubate anybody, the smell,
it depends.
It's not the pus, it's just
the bad breath smell.
Everybody has it.
It's that bad
Everybody
breath.
has it.
Yeah.
I think the two
and they extubate and they go
huge breath out. Huge breath out. You're always like,
right in
everybody. I'm like petrified to have to have surgery because I'm going to have that bad post-extubation smell.
It's disgusting.
Oh my God. Everybody has it. I don't care how much mouthwash you use.
That, and when you look at the mouth and they get the white, like...
Oh no! No, I don't like that either.
That white pasty shit around their lips. Oh my God.
Why?
Why am I doing this job? I don't know. It's disgusting.
It really is.
Okay, clearly Laura's are way better than mine. School did not teach you how to deal with death. We already talked about. School did not teach you how to deal with feelings. Well, I don't have feelings, so maybe we should skip this one. I'm a cold-hearted bitch.
Well, I think they don't tell you, like,
Well, you'll
shit like it's okay to cry with a family that's
right.
crying for the death. I mean, you can't be the unconsolable because they can't be consoling you.
Right. So sorry,
but you can go ahead.
You don't want the family consoling you because that's a bad problem.
No, you can't get to that. But you can cry with. I remember, my high school boyfriend. His mother died, and we're like, there's a million of us in the room, and she's dying, and the nurse, she's like, yeah, this is, any minute, and they're like, okay, and she said. And I think one of the kids said, can you stay? And she said, yep. And she sat down and she started crying right along with the rest. And not unconsolable, but crying. Yeah. Because it was sad. And I was like, she's a person. Like, she cares. Like,
and you take that home with you.
Yeah. And I still remember her doing it. And I was like, she cares that she's dying. It's not terrible to show emotion.
Right.
You can't be the one who has to be taken care of.
True.
But you can show your emotion,
Well, they also talk about feelings of joy. Like, whenever I scrub a C-section and the baby comes out, I'm done. I'm looking at toes. I'm looking at hands.
So
yeah. They're like, to a comic. I'm like, yeah. Mm-hmm. I'm looking at the baby. I can't. They lose me every single time. It's a disaster. Yeah. You've got me right to the moment that baby. And then I'm like, oh, look at the baby. Look at the baby. Oh, he's looking at daddy. I can't stand it. Yeah. So feelings of joy, depression, we talked about, excitement, adrenaline. Oh. Okay, so we put a reel out, and it was questionable, but it was like, when Laura and I, when we get a gunshot wound to the chest, it's a horrible thing to happen to somebody.
We don't want people to be shot in the chest.
Right, but from an OR nurse point of view.
From a trauma OR nurse. That is our job. Yes. That's our wheelhouse. Like, that's, we like to do it. We like the excitement of it. It
challenges my knowledge. Am I going to know what to
you? Yes. What am I going to do? What am I going to hand them? Because they're not.
It's not a routine
do I need blood?
thing. Do I need
it's never a routine. So you have to be thinking ahead. So it's a chance. Like, am I going to get this right?
Right.
Are we going to save this person?
Right.
We want to save them.
Right. What's going to happen?
Can we fix them?
Yeah.
What can we do that is going to do this?
I am an adrenaline junkie.
Yes.
I love trauma. That's why I'm a trauma nurse and have been forever. I've never worked days. Not my thing. And it's hysterical because if somebody's like, oh, we've got an EVRA coming in. It's all yours. We got that. It's all yours. Gunshot. It's mine. Mine. Stab. It's mine. I got this one. I'll even take an emergency cranny.
Right.
Because I love it, you know. But any other case, I'm like, oh, you can have your lap back.
That sounds boring.
And we all fight over scrubbing it.
Yeah.
We all fight to get in that room.
Yeah.
There's 800 because everybody's an adrenaline junkie and everybody wants to see what happened. Right. It's not that we're relishing in the tragedy of what happened.
Awful. And it's awful.
Right.
But we also, on the flip side of it, you have the adrenaline from it. But we're also there caring for that patient if they don't survive, taking good care of them,
right,
making sure they're cleaned up, making sure they're presentable, sitting with the family. We do all that. And we take that to heart as well. It's not that we're like, oh, yay, they might die. It's not that. It's
what we do.
It's like
this is our job. This is what we do.
The camera rolls in, you're on. That's what you want to do.
It's the most my light's on at work is when a trauma comes in. Yeah. That's when you got me.
We're not asking for people to be hurt.
Right.
We don't like it, but we like that kind of case. It's
exciting.
It's the fast pace. It's the you don't know what's going to happen, but am I
going to know? Can I anticipate this? Right. Am I going to have this ready? Am I going to have, do I know where this stuff is? Are they going to have it quick?
Right.
Who's going to help? It's just, I like the adrenaline and I like the excitement of those cases. Right. So we're not horrible people.
We don't wish bad on anybody.
Exactly. Go ahead.
Your scheduled shift is really just a guideline. It is really just like an 8 or a 10 or a 12. Right. It's, that's you're working 7 to 3. Okay, you might be working 7 to 3. You might be forced to stay and finish your day. Or especially people on the floor, they don't leave.
No, they get
ever
notes
on time.
And
they give a whole report on their, 8 goddamn patients. And that takes an hour in itself. And then they have to finish up their records and, do whatever. They're never out of there on time. Ever.
I mean, fortunately, one of the benefits of the OR is usually if you're off at 3, you're off at 3. There's no notes for us. There's no fixing this. There's no doing that. Oop! If you heard a big bang, it's Laura's.
Yeah, sorry.
So it's different in the OR, but you're in the OR. If it's a busy day and there's no relief, you're staying.
You're stuck.
You're stuck.
It is what you can't just leave the patient. You can't just leave that patient.
Yeah.
So, and it's not like one nurse can cover 2 rooms.
Right.
You need a nurse.
It's a 1-to-1 thing, and that's it. And if there's no nurse to get you out, There's no nurse to get you out.
Nope, you're staying.
Unfortunately, most people usually will volunteer because either they like the case, they like the surgeon, they'll say, oh, I'll stay, I'll finish.
Right.
Doesn't happen, it happens a lot where we are, fortunately, or we couldn't run that place, I'll be honest with you.
Oh, no, we couldn't run it without overtime.
We couldn't. All right, schools don't teach you how to deal with the doctors. No shit.
They do not.
Doctors are human like everybody else. They come in all shapes, sizes, and personalities. Mm-hmm. And part of being a nurse is you can be the nurse that diffuses the situation, or you can be the nurse that's going to escalate it every time. And you don't want to be the escalator. You want to be the diffuser. Mm-hmm. I am both. It depends on the surgeon, depends on the day, and it depends on how he's approached the situation.
Yeah.
We just recently witnessed one of the best things I've ever witnessed in my entire fucking life at this place.
One of my favorite days.
I couldn't have been happier.
No.
And I can't even explain it to do it the justice it did.
Because you'd have to get into it.
But a surgeon came out to bitch about his case, which is not unusual. It happens all the time. Mm-hmm. The people who do charge at the OR desk take a brunt of shit often, mm-hmm. Laura being one of them. Mm-hmm. And it just happened that this particular day that one of the surgeons came out to bitch, the head of the OR and very high up in anesthesia and our manager were all standing at the desk. And they diffused that situation, or at least dealt with it. I don't know if it diffused it.
I don't know that they diffused it.
But they dealt with it beautifully.
Yeah.
And never do you see management actually see the shit we go through.
Right.
And so to have them be, I was like, this is the best thing I've ever seen.
I literally came home. I was like, I had big brothers, and I was just sitting there, and I didn't have to do anything, and they just took it over, and I was like, oh my god, this is the best day that I've ever had. Because if it was like 5 minutes later, I would have been dealing with it for a half hour, going back and forth, and
then you'd have to write an incident report, and they would have just heard secondhand.
Be, calm,
but it's hard.
It's very hard.
It's hard.
I want to scream and I want to throw something, but I don't. And I just continue to say the same goddamn thing I've told you for the last 20 minutes with you screaming at me, and I say it. I'm not like, oh, I'm sorry. But it's, okay, well, I don't know what you want me to do. This is the facts, and this is all, and then it just goes on and on and on. And I think I'm a girl.
Doesn't help.
Because
we're two big men that we're dealing with it.
Yes.
On the flip side, doctors are under a lot of stress.
Yes.
They are dealing with a lot of shit as well.
Mm-hmm.
So don't feed into their bullshit and try to diffuse the situation. And you don't have to take shit from them. Right. God knows you don't have to take their shit.
Right.
And don't let them treat you terribly. Mm-hmm. But try to be the diffuser. Yes. And not escalate.
Don't escalate it.
I mean, you see some nurses go in and you just know the moment anybody comes in that room, it's going to be a shit show. Mm-hmm. Or you can go in and you can calm the room down.
Right.
It's really... the circulating and scrub roll really affect the room.
Yes.
Those people can really make or break your room. Mm-hmm. And I'm sure on the floors, it's the same way. I've never had any floor experience. I have been in the OR since I was 20 years old. Yeah. So I can't speak for floor nurses, but I can tell you in the OR, you can make or break a room.
Yes.
So you really have to.
And getting them all, there's a way to approach things that gets the point across or gets your concerns across without
being an ass about it.
Bringing them to a point of boiling.
Right.
Because that's not good for you. That's not good for them. That's not good for the patient.
Right.
Like, make your point, but bring your point across in a
And there's a time when you can pull, like, it may not be the time then to say something, and you wait till the case is over and you pull them aside and I didn't appreciate how you spoke to me.
Right.
This is what was going on. And I didn't deserve you talking. And more often than not, they will apologize.
Yes.
I mean, I know the floors are different. Like I said, surgery can be very difficult. Surgeons are a whole different breed.
Yes.
And you have to have a thick skin. You can't take everything they say personal. Mm-hmm. If you're that kind of person, the OR is not for you. Let me tell you that right now.
Yeah.
All right. But you there's a time and a place for everything. There are situations where the surgeons have been brutal and I just let it go because now is not the time.
Right, now
but I will get you later.
Yeah.
We're going to put that in the bank.
Yeah.
So
we are talking about this.
So yeah, nursing school is never going to prepare you for that. Especially, it's very difficult when you're young to try to have that presence to talk to them.
Yes.
Because most doctors have already done 4 years of college, 4 years of medical school, so they're already significantly older than the 18-year-old who's in nursing school.
Mm-hmm.
And you're not going to say what you want to because you're intimidated.
Right.
Even if you're right, you're going to be intimidated. So
Yeah.
you have to find your voice in nursing school.
And hopefully learn how to say it
Appropriately.
Yeah.
I agree.
Because, yes, do I want to sit there and
Fuck
yell
you!
at you? Like, are you fucking kidding? Do you see how hard it'll work? Are you fucking shitting me? But
Yeah.
I don't. I just say it very calmly.
When he turned around and said, why can't you just make the nurses do overtime? Are you kidding me, you son of a bitch?
Yeah.
They're all doing overtime.
Right. Everybody's doing overtime.
Did you not read the news?
Right.
There's a nursing shortage.
Huge nursing
you piece
shortage.
of shit.
Let's not push them out the door.
I don't want to be here. Well, neither do I. You think this is my dream?
Right.
To spend all my time here with you?
But I don't say that. I say, well, this
On
is a
the
situation,
inside.
and this is all we can do. So
Yeah. I mean, we've been wearing masks since the birth of surgery, so we get to say a lot behind the mask. We should have an episode behind the mask.
Yeah.
Shit you've said behind the mask.
Oh,
Yeah.
wouldn't be pretty.
Fuck you, piece of shit.
I know.
Eat
And
me.
it's actually, this next one is actually about that.
Go ahead.
You will need a poker face that could win you millions of poker money in Vegas because, well, people, you have got to pull your face together.
Yeah.
We wear
The
masks.
eye roll.
Yeah, I mean, now everybody wears masks because of COVID.
One of my girlfriends known for her eye roll.
Oh my God. Her eyes, I don't know how they didn't fall out of her head with the eye roll. But you can't. We say a lot with our eyes because we've always worn masks.
That's all we have.
So
Yeah.
we literally have whole conversations with just our
Mhm.
eyes. But you gotta keep them in check because they'll say or do something and you know your face is out of control. Thank God there's a mask, but you do have to control the eyes.
Laura, what is the most professional way to tell a doctor, fuck you? Do you remember? Yes, doctor.
Oh, yeah.
Right away, doctor. They know.
course,
They know.
doctor.
They'll be like, oh, I get it.
Mhm.
They know what you're saying. That's a quick, yes, doctor, right away. That's another way of the OR saying, go fuck yourself.
Yeah. You have to, but you gotta keep your face in check.
Yeah. It's not easy.
No.
It's not easy.
But even with the patients.
I was just going to say, even with the patients or the patient's family, when they're like, they may have the worst surgeon in the world. Is he good? Mm-hmm. They're going to sleep. What am I going to say? No, he's terrible. Get off this table and run for your life. I can't say that.
No.
He's going to do the best job he can do. That's what I say.
We're going to take really
We're
good
going to
care.
take great
We're gonna
care of
keep
you.
safe.
Yeah. I'm going to take great care of you.
Yeah. But you have to
I'll try to make sure he doesn't cut up the
you
right
know
way.
they come up with weird things.
Yes.
You
Yes.
can't, you gotta keep that face in check. You can't be like, you did what? You put that
One
where?
nurse
Like,
had a girl come up and she had lost her arm and didn't know it. She
Yes.
couldn't feel that she had lost her arm. And she's like, I can't feel my arm. And the nurse was like, don't worry about that. We're just going to get you. Like, what are you going to say? Yeah, because it's
yeah, because you don't have one.
it's left behind at the scene. You don't
Yeah.
have one, you know? Yeah, there's things you know, what happened to so-and-so? Don't worry about him right now. Let's get you to sleep. Let's take care of you. Yeah,
Yeah.
it's very hard because
Yes.
some of the stuff you're like, oh my God.
Yeah, and they
Am
can
I going to
see it.
die? We're going to take really good care of you.
Right.
I never say to somebody, no, you're not going to
No,
die.
I just-
Or everything's going to be fine.
We're doing the best we can for you.
Yep.
Yeah.
Oh, it's
Yeah.
been hard.
It is. But you have to keep it together.
Yeah.
For that, they'll see it on your face.
Oh,
even
all
if
day
you're
long.
saying, oh no, we'll take care of you, but you're panicked looking
Yeah.
around the room, you know, like you gotta keep your shit together.
Yeah,
To
absolutely.
keep them, their shit together.
I have no more in mind.
Oh. I do. And it actually relates to all the things that were posted on our Facebook post about what you did not learn in
Nursing
nursing
school.
school. And this was a huge one. They said you will need reflexes and physical strength that no sport could ever train you for. You
No
have no
shit.
fucking idea how physically demanding
Nursing is.
nursing is.
Lifting,
is-
pulling, crawling, jumping,
Oh, it is.
running.
You're under. I've told the story. I was like 9 months pregnant and they dropped something under the bed and I had to go get it and I got myself under there. Under the sterile drapes and all that. And then I'm like, I can't get myself the fuck out of here. Like, if you have to be like a contortionist.
Yeah.
I mean, the way you're bending and. by
You
the end
ask
of
them
this
14 times, do you want a Foley? And they say no.
And then you're under
drape
the
patient,
goddamn
and then you're going to put a
sterile
Foley
drapes
in.
and trying to put a Foley with no light under
Yeah.
with their legs belted down. I mean, it's like insane. The contortionism and the
Yeah.
strength you need.
Even
We're
on the
lifting-
floors, you're lifting heavy patients. These people, 300-400 pounds.
Yeah.
Then you got to take 6 people to lift them, and they're dead weight because they're sleeping,
Right.
or they're dead weight because they have an injury,
Mhm.
and you're on the floor trying to lift them.
Mhm.
We don't have Hoyer lifts in the OR.
No.
It's all you.
Yeah.
You know?
Whip, just physically, like 4 people.
Yeah.
It's
Trying to
a
move a
lot.
400-pound patient.
Right.
It ain't easy.
No.
You
It's-
know?
And just, you have to get in between things. Like, you're constantly, like, can I fit in this little area to get to the top of the room? Like, it's insane. You're like, no, I think I can. Oh, I hope I can.
The sponge is missing, so you're on your hands and knees looking under the bed to see if that's where the sponge went. Yeah.
With your eyes, straight on your eyes, trying to find a needle on the floor, and you're crawling around on your hands and knees on the disgusting. I mean, we clean it, but it's still. I mean, there's blood and shit all over. It's there's fluids leaking from above. There's fluids below you. You're trying not to crawl through puddles.
Try not to slip on them.
Yeah, it's. I mean, it's.
Yes.
It really is a physical.
It is physically demanding, and in the OR, if you're scrubbed, you're standing for 12 hours. Yeah. If you're circulating, you're running for 12 hours, and by the end of my back is shot. My knees are shot. Started with plantar fasciitis last summer. Never had that in my life, but that was from bad shoes in the OR and walking around nonstop. Yeah. And our OR is huge. Huge. So we are walking miles because you're in 4 buildings across, I don't know how many blocks. I mean, it's ridiculous. It's huge. So it's very physically demanding. Yeah.
And now we're in the OR. I mean, I'm sure there's shit on the floors that you could say the same thing for. We're draped. Everything's sterile. If something drops, you can no longer use that. So when something's sliding up, you're reaching, you're grabbing, you're running across the thing like you have like cat-like reflexes to grab this shit. It's like, and everyone's like, oh, good catch. I'm like, I know.
It's like cat-like reflexes.
Right. I mean, sometimes you don't catch it, but you're constantly like on high alert. Like, where am I going? What am I going to do?
Sometimes you're making sure that the fucking med student isn't the one that's dropping to the ground. Yeah. Somebody just said the other day, they went in and it was the smell of the Bobby got them, like you said earlier. And she could see it coming, and she was like catching them before they go down. Like, it happens all the time. All the time. It's usually they're going to tell you they're hot before they tell you anything.
I think it's always the fidget to me. They start grabbing their gown. They start touching. They're fidgeting, and I'm like, oh, you're going down. All right, we got to get you a seat. You can't.
And try doing chest compressions on somebody. Oh, it's exhausting. It's exhausting.
Your ribs hurt the next day.
You don't think 2 minutes is long? So you're doing chest compressions, and then your abs hurt, everything hurts, it's exhausting, you're sweating, and, they're not deep enough. You're like, oh my God. Yeah. So there's a lot of physical in this job.
That equipment.
Oh my God.
Pulling the equipment, pushing the equipment, doing, these things, you're holding open a door with one leg, you're pushing a machine through that weighs
however much.
Hundreds of pounds. Yep. You're pulling that through with your leg against the door. It's ridiculous.
And you wonder why everybody's back is tweaked.
Yeah, and then I'm like, can you carry the laundry upstairs for me?
Yeah, if you've ever moved an OR bed, especially the old ones, remember the old ones?
Oh my God.
They weigh a goddamn ton. It's ridiculous. Yeah. So one of the things on the Facebook page that I talked about was the beds. We have this big debate going on at our hospital where all anesthesia wants every patient on a stretcher. It's not ideal to always put a patient on a stretcher. You have to put some of them on a bed because it's just what's best for the patient.
It's best for the patient. Yes, you might throw your back out pushing the goddamn bed.
The beds are brutal.
But the patient deserves a bed sometimes.
But you're going to... And they get more complicated. Dry, neutral, super space, hyperspace. You're like, I don't know what to do with this bed. I just want to put the fucking back up. Yeah. What button am I pushing?
I said, someone put that, and I was like, you could literally have a semester on beds.
Yeah, and still not be enough.
And still have no idea which plug to plug in to get that.
And our hospital goes anywhere from the stone gurneys from 1812 to the newest
space age.
Space age, that they flotate to the bed.
It's unreal.
It's ridiculous.
You never know what bed you get.
That was a big one on that page. Beds. Was the beds.
How the hell do you work all the goddamn
beds? The beds.
And then in the OR, we have OR beds that we
have 18 different ones.
8,000 of. That some
you get
slide,
the GU bed, the GYN bed, the EVA bed, the regular bed, the EVA
bed that rolls, the EVA bed that doesn't roll. It's insane.
We do actually, when we get new people, we do a class on beds, and it's still not enough. No. Another one they talked about was the crawling around, like we crawling around with the cords. Yeah. I always joke that before I retire, everything's going to be cordless. Because I'm tired of tripping over cords.
You literally, well, never mind the tripping over, but getting the patients, it takes forever to get their IV pumps over, and they're on a lot, and these sick patients, and, all the IVs are untangled, all the lines are untangled. You move them over, and somehow
they're all tangled again.
It's like everything just warped into each other and literally knotted itself out. How? We just spent an hour fucking untangling them.
My favorite is the type A anesthesia who tapes them all up. And then you go to move the patient, and you have to tape them all because there's not enough line. Yeah. I get they tangle, but you can't tape them all up either. No. One guy had bread ties. Who carries around fucking bread ties in their pocket? But he bread tied, which was smart because it came off easier. But when you tape them, you can't get them undone. No. Wow.
Yeah. It's a nightmare. Yeah.
That was a big one. You're moving pumps, and you're moving this, and yeah. And then even just you've got, depending on the surgeon, because we have some surgeons that really like their pedals. you've got the scope tower, you've got the Bovie, you've got the harmonic, you got the ligashore, you got the sauna thing, you got and they all have a fucking pedal to go with it. So there's 14 pedals in front of the surgeon. So those cords are, and you're crawling under the bed.
Gotta place it, and then you gotta get it back to get it out of the way.
And then they're all plugged into the wall because nothing's cordless. Right. And then all the cords coming from the field. It's ridiculous. It takes you 20 minutes just to get, and then they're like, can we do a timeout? What do you want first? Do you want me to plug the 42 cords in first, or do you want your timeout? Which one do you want? Because then you're going to be yelling at me because the timeout's done. You don't have a Bovie plugged in.
But you can't stop because nothing's plugged in.
Right.
Yeah. God love them. Another thing, a lot of it was talking to adults that are acting like children.
Yes. I mean, I've literally seen them stamp their feet. Like a 3-year-old.
Bang their heads. Yeah.
Oh, bang their heads.
Yeah, big one. Throw things.
Throw shit.
It's literally
temper tantrums. Throw shit.
There's temper tantrums. They do not teach you how to look at a grown-ass adult and be like, are you fucking kidding me? And get them calm.
So they stop having a fit and they can finish the surgery.
Yes. Yeah. That was a big one. Moving the heavy equipment was a big one. I liked this one. How to rip tape and put steri strips on with gloves on.
Yes.
It's never impossible.
Do you know how many times I've gone to use my teeth?
I know.
I'm like, I'm sterile. I can't do that.
No, not good. Not good. No. Yeah. It's with the fucking glove. It's near impossible to do.
Classic. This is another one that was on there. So you're trying to do a timeout. You're trying to plug everything in. You're answering phone calls. You're doing all this shit. Can we have some music, please? Excuse me?
I literally, the second they ask me for music, I ignore. Yeah. Now I'm not even.
Now I'm going to punch you in the face.
Now we're not listening to music the whole case. I'll keep forgetting to do that.
I'm going to put on fucking classical, like, I don't know what. I'm going to put on ABBA. Nothing but ABBA. I love ABBA. That's all you're going to listen to now, you piece of shit. I've got a million things to do.
Literally the last thing I'm doing is worrying about music.
The beepers are going. Can you put on the music? Okay, yeah, sure. When I've done I literally looked at them like, when I'm done with everything else I need to do, we'll put your music on. You son of
That's my most
classic.
Yeah.
Classic one.
Yep, I'll get to that.
Yeah.
I don't give a shit about your music.
Stat music.
Yeah. Let me do my job and then I'll worry about music later. Relax.
We're gonna put on polka.
Yeah. Being a DJ is not my and then I always say, what do you want to listen to?
Whatever you want.
Oh, anything. I'm not fucking picking. I'm probably in there for a lunch. I don't give a shit what you listen to be honest. As long as I'm not putting country on.
But that's when I tell them, all right, so I'm going to put on polka. Oh, no. Okay, so how about hip hop R&B?
Yeah. Oh, I like this very specific thing that you actually have to spell because I don't even know what you're talking about. Well, how about you just say that to begin with?
And we have one surgeon who cranks the music and it's all that fucking club techno. I'm like, I can't give a break in that room. I can't.
No. It's awful.
It's the worst. It's the fucking worst.
Yeah. I hate playing DJ. That was a big one.
That was a big one.
Yep.
The beepers and
holding. If you don't work in the OR, you're not going to get it, but
because it's sterile.
The surgeons have their gowns and gloves on, so they can't touch the phone. So then you have to hold the phone without the cord touching them, because you have a cord on your phone, to their ear.
So they can hear.
And talk. But then they're constantly fucking moving.
Yeah.
And it constantly slipping out from the ear, and then they're looking at you like, I can't hear. Yeah. And then you're readjusting it, and then the mouthpieces go. It's a nightmare.
It's not a quick phone call.
No, it's never quick. Can't we just put this on hands-free? No, I'll just take it on the phone.
Yeah. And you're standing there and your arm's starting to shake.
You have to hold, I hold my elbow up.
You've got a million other things to be doing.
And now you're
I'm not your fucking phone holder. Yeah. We had one who would be like, could you call the nanny? I'm going to be... No! I'm not your secretary. No. I'm not going to go get you dry cleaning and call the goddamn nanny. No. I got shit to do. Yes. I got to go get you antibiotics, you know?
Yeah, I hate holding that phone so much. I'm like, this is so fucking awkward.
That fucking phone.
Changing the batteries or getting their pager off their pants. They put their pages.
I swear.
They do it on purpose.
They do it on purpose.
Swear to God.
The beeper is in my penis. Okay, yes.
Yeah. It's always, in the front.
Yeah.
To the right.
Over to the left.
Oh, I'm sorry, the left. The right.
A little hotter. A little hotter.
Yeah.
Yeah, that's it. Like, really?
And it's under their gown, so you can't see, so you're digging around on
and
their
you don't know what you're going to find.
You never know. Looking for their phone. Could you get my phone out of my pocket? It's in my back pocket. Yeah. Well, there's 14 things in here, so now I'm digging.
You know what I love
around
to do?
Your ass.
I'm a terrible person. I take the headlight out and I put it in their pocket. Psst. That's nice and odd.
Well, we always used to do that, and now they don't let you do it anymore because I'm going to get burned. It's going to hurt for like a second.
I don't give a shit. It's like a match.
But
here
now
you go.
I'm walking you around like a dog on a leash.
Yeah,
holding the fucking headlight. I'm putting it in your pocket.
Can you move my heated blanket to the other side of the table? Oh my God.
Yeah.
Oh my God. I never thought I'd be doing these things.
No.
And
it's
the beeper. It's over to the right. It's over to the left. It's the front.
I'm sorry. Oh, no,
actually. Oh, it's actually in my front pocket. Yeah. Could you grab that one? Yeah. So you're like feeling up these dirty old men.
It's a lot of fun.
I hate it.
A lot of fun. Yeah. One person said, like, how to retrieve a ringing cell phone from a gown and glove surgeon without 1, contaminating them, or 2, sexually assaulting them before the ringing stops.
And then you can answer and it's their wife. And you're a woman.
I said, people like answering the surgeon's own phone. I literally hate answering the surgeon's phone. I answer
it like the OR phone. OR 32, Nicole speaking.
I say, Dr. Jennison's phone. Laura speaking. Yeah, like, I want you to know I'm answering your husband's phone. Like, I'm...
Yep.
Yeah. Very weird. Very, very
I do
weird.
The same thing.
How to use a computer. They don't teach you that. How to be an IT tech.
Oh, troubleshooting all that.
Troubleshooting computers is not what I should be doing. No. I can't turn my TV on at my house. Why I'm touching millions of dollars worth of computer
Hit that button. Turn that off. The friggin' Brain Lab shit and the microscopes. Just hit that. Turn that up. Dial that. Do this.
The Black Diamond. I'm like, okay, I'm going to shut this whole system down, I guess. And then hope to God it comes back on. Yep. And then I'm here to do IT.
I need you to take a picture. Can you conference call that? Can you take another picture? I need a video of that now. Can you send the video? Can you transport it out? No, I can't.
I don't know how to do that.
Use my cell phone.
I literally can't put my TV on in my house.
But I'm not. No, I can't do all this shit.
But I somehow know how to fix all this shit at work.
Hello, Biomed. Or I call you.
It's awful.
Yep.
It's real. I should not be touching this stuff. Body mechanics, huge thing. They do not teach you that. Yeah, bend at your knees. Okay, but how do I get under that bed and over there? And, what else did they say? The phone holder human statue thing.
It's brutal.
Answering everybody's pages.
You're sometimes like, so one of the
girls
don't
be sloppy
was saying her fiance called and said, oh, she just answers phones and stuff at work. I was like, really? He wouldn't be my fiance anymore if he said that to me. We do so much more than answer phones at work.
Like we said, we're like a hidden... Yes. No one knows about us. You don't learn about us in nursing school.
We're a different type of nursing. No one
understands what we do. And it's very hard to describe what you do because you don't know what we're talking about.
Right.
So yeah, you plug shit in and then you sit there. No. We listen. We're doing our chat. You can hear that suction pick up. They're bleeding. I know. I need to get prolines. I need to get suture booties. I need to get pledgets. I need to make sure they have fine needle holders for that thing. We're doing...
Because they can't get any of it.
8,000 fucking things in our heads. You can't see us do.
Beep, beep, beep. You're looking at anesthesia. I got to go get the code card. I got to go get the med card. I got to get, do I need an ICU bed? Do I need,
Right.
You're constantly...
And it's very hard to describe that. And when no one has gone down there or learned about it in nursing school...
And one day in the OR is not going to teach you that.
And we have a friend that's in nursing school now, and she'll show me her things, and she's like, Laura, they literally talk about pre-op and then post-op, but nothing. I said, we don't exist. I don't know how many
times
like the
redheaded stepchildren of the hospital.
We do not exist. Our jobs do not exist to people, and it's a disservice because A, you're not helping people come to the OR, which we need.
Right.
And B, wouldn't knowing what we do help you on the floors afterwards? It's going to help any nurse to know what the hell it is we're doing.
I honestly believe every department should take a stroll through the other department. Mm-hmm. When the ICU is telling us it's 2 hours to clean the bed, and we have a patient downstairs waiting, they have to see why. And we should see, why is it taking you 2 hours? Right. Like, maybe there's stuff we aren't worried about, instead of just yelling at each other about why.
Right.
Or when the ER brings a patient up full of valuables that we really can't deal with. I mean, they send patients up. We have patients come up in wheelchairs. What am I going to fucking do with all this stuff? Mm-hmm. I don't have a place to put all these patient belongings. Right. I mean, they sit at the desk. Mm-hmm. They have to understand why we need you to take this stuff off.
We don't have an area to put clothes and wallets and rings and whatever.
I think nurses seeing how other nurses work would help.
Yeah.
Stop being bitches to each other.
Right. Help support each other.
Exactly.
Understand the rationale so you'll do it.
Right. Maybe you'll understand, okay, it's going to take them 2 hours. I understand that.
Right. You always see what happens. And this is,
Well, maybe we won't make them wait 2 hours because this is why they need that bed,
Right. To speak up for yourself.
That's hard.
To speak up for your patients. That you need to learn how to do housekeeping, IT, engineering, all that stuff. They had really good...
There was like 300. A lot of them...
It's unreal.
Yeah. It was funny how many people were touching on the same things.
Yeah. And it's... someone was like... you make it sound so terrible. And I'm like, I don't think I love my job.
I love the OR. I wouldn't work in anywhere else.
But I didn't learn any of it in nursing school.
No. I remember my, first nursing class, and they're going through, what do you do? What do you have? I was like, oh, I'm a surgical tech. She's like, you better go to the floors, honey. You can't go back to the OR. Nothing you learn on the floors is going to help you in the OR. So why do I need to go there for 2 years when I know I'm going right back to the OR?
Right.
I never went to nursing school to do anything but OR nursing. Mm-hmm. That's my wheelhouse. I love OR nursing. I love what I do. Yeah. I am not going to go work on the floors or an ICU or the ER or anywhere else. I will be an OR nurse till the day I die. Mm-hmm. You know? So
it's nothing bad.
But you can't learn it anywhere.
No. Regular nursing. Any nursing you do, it's mostly on the job training.
Nursing, I also think it's changed a little bit because most OR nursing, when I started, were techs becoming OR nurses.
Yes.
Now they offer these peri-op programs that were not available before. If you hadn't worked in the OR, you couldn't work in the OR.
Right.
Now they're offering, I think with any nursing field, you can come out of nursing school and go to the ICU. Right. You couldn't do that years ago.
They offer those internships and they train you for 2 years.
You couldn't do that. It was 5 years on the floor at the minimum, and then you go to the ICU, which I think helps because it gives you your basic skills.
Right.
These NPs who, they were an art degree 3 years ago, now they're an NP, but have never touched a patient. You have no assessment skills. Right. You have no skills. How are you being an NP?
You're learning it.
Yeah, but you haven't done it.
But I learned that in school too, but until you got on the floor and
look at how much we just talked about. You don't know.
Right.
So how are you going to be an NP when you have never touched a patient?
Yeah. I
think it's dangerous.
It's a little frightening.
Yeah.
A little frightening. But, and one girl said, I liked her. I liked all the replies. But one girl said, think outside the box. They do not, we already touched on that. They do not teach you that you have to sometimes. They want this or this, and you're like, hey, what if we got this and did this? You have to think of other ways to do things because it doesn't work the same way every time.
We've talked about stuff episode. Yeah. That's when nurses are going to get their most creative.
Yeah.
How am I going to get this baseball out of his ass?
Right.
Because we don't have an instrument to get a baseball out of the ass. Mm-hmm. And you're trying to do it so you don't have to cut them open.
Right.
So you get very creative.
Right.
Let's try forceps that they use for babies. Mm-hmm. Let's try suction. Let's try this. Yeah. You have to think outside of the box because they're going to...
we did this to do this, so maybe this will work for this.
Right.
Yeah.
So...
you have to think outside the box.
I think that's crucial.
Yeah.
Well, did we touch on mostly everything?
I think so.
I do too. Nursing school teaches you how to take the NCLEX, and it teaches you the bare minimums you're going to need as a nurse. You're going to touch patients. Mm-hmm. You're going to learn how to give baths. You're going to learn about medications. You're going to learn how to delegate. You're going to learn safety. You're going to learn sterility to a point.
Yeah.
To a point, when you're changing dressings, you learn how to change dressings. I learned that in nursing school. I did.
Okay.
I don't know.
Yes, I did too, but it's still, I was like, this is floor sterile.
Yes, exactly.
This is not
sterile.
No,
There's
sterile. A difference between floor sterile and OR
I agree.
Sterile. They taught you how to wash your hands the opposite way you learn in tech school.
Right.
In nursing school, your elbows are clean. No.
In tech school, you're 2 inches above the elbow.
No, but they go the opposite.
Yeah, they come down.
They come down. We go up.
Right.
And when they would teach me, I'm like, I can't do this. This is not how you clean yourself. And they're like, no, your hands are the dirtiest. Like, no, your elbows are the dirtiest. Like, it's a completely...
Because you've just cleaned your hands.
Right, you don't want... everything's so different, but there's floor sterile.
Right. So, it's not that nursing school doesn't teach you anything. It does. It teaches you the basics to get you out there safely.
Right.
And then you're going to learn everything else on the job.
Right.
And it's going to be hospital specific as well.
Yeah, like with the beds. Oh yeah, we could do a semester on beds, but you can't because every hospital has...
It's a different bed.
A different bed.
Different equipment.
Yeah.
You can go out to the West, and California seems to be light years ahead of the East Coast sometimes. Mm-hmm. They have equipment out there we haven't seen yet.
Mm-hmm.
And we won't see because we're very entrenched in, tradition and routine
mm-hmm.
out here. So I'm not saying nursing school is terrible. Nursing instructors can be brutal. I remember one poor girl, they left her like she had to give a shot. There's no shops box around, and she couldn't recap the needle. But they didn't want her walking around with an exposed needle. And the clinical failed her. What was she supposed to do? Because she recapped the needle, but she did it, kind of the scoop.
Yeah.
You left her no options.
And what did she say that? Like, what was I supposed to do?
She did. And the woman's like, you're supposed to figure it out. So nursing instructors can be
so I would have recapped it safely.
Right, because you can't walk, you didn't give her a shop's box.
Right.
Where if you were in a room, there's a shop's box there.
Yeah.
So it was just, they set you up for failure sometimes, and I don't like it.
Mm-hmm.
And I don't like, that's a little bit of nursing eating their young there as a nursing school, because the instructors, you know, like, oh, if you do this, it's a failure. If you do this, it's a failure. They scare the shit out of you, like, day one. It's like, does it need to be that way? No. I'm taking this serious. Like, come on, you know?
Yeah.
All right. Again, we're rambling. So,
as always,
listen, we need nurses. So if you're not a nurse and you're listening, get the hell out there and let's get to nursing school, because we need nurses. I gotta retire someday.
Nursing school is not
terrible.
It's like any other school.
Yep.
You gotta do it. It's not that bad. Listen.
Mm-hmm.
Just listen.
Use your common sense. I think 90% of nursing is common sense.
90% of nursing is common sense, without a doubt.
Yep.
Without a doubt. And then the other 10 is
critical
thinking.
Yep. How to use your common sense and your critical thinking.
Yep.
Personal skills. You have to you're troubleshooting 24/7.
Mm-hmm.
You are always troubleshooting at work, putting fires out. I find like now, especially in the staff development role, I'm putting fires out, even with experienced staff.
Yeah.
Calling me for stupid shit. I shouldn't say stupid shit, but for stuff that you're like, okay, you need to do this, this, and this. Okay, you need to do that. You know, don't hook the fucking NG tube up to the doorknob, because that's not a good idea.
Right.
All right. 100th episode coming up. Send us your ideas. Well, hopefully by the time you sent us your ideas, have an idea. But you got anything you want to say? Tell us what you liked about the podcast. We'll take anything you have, because I can't believe we're 100 episodes in.
It's crazy.
All right, Laura.
Crazy.
Catch you on the flip side.
Bye.
All right, good night.
Like, subscribe, rate, and review the Scissors and Scrubs podcast on whatever podcast app you listen to us on. Follow us on Twitter, Facebook, and Instagram at Scissors and Scrubs. And email us any of your stories or thoughts to scissorsnscrubs@gmail.com.